see the effectiveness of TCM therapeutic methods associated with acupuncture, catgut insertion. Catgut embedding is the term in acupuncture, and acupuncture point injection in the recovery of paralysis after spinal trauma. The subject of this presentation is the effect of the periodic insertion of resorbable surgical thread and point injection at certain acupuncture points in a case of tetraparesis after cervical spine fracture with partial section of the spinal cord in a 15-year-old adolescent. For pity, we have in our country many young people who have this problem because so much courage, and I don't know, maybe not enough mind, but they have they suffer spinal cord fracture and medullary section with so bad results in conventional medicine treatment. But TCM has a lot of methods to help them. And you will see, I have even some small movies. Acupuncture as treatment method of traditional Chinese medicine is more effective when the points prescribed are dictated by the therapeutic principle resulting from the TCM diagnosis. The methods by which acupuncture points can be stimulated are numerous, all aimed at restoring the body's energy balance. The insertion of absorbable surgical thread at certain acupuncture points is useful for prolonging the therapeutic effect of acupuncture in tetraparesis caused by spinal trauma. In parallel with acupuncture treatment, the insertion of surgical thread is important in the recovery of patients with tetraparesis. This article, this presentation demonstrates the effectiveness of this method through a clinical case study. Let's speak a little about this absorbable surgical thread who has to be inserted in acupuncture points. The insertion of absorbable surgical thread is a new subtype of acupuncture treatment that involves the insertion and integration of certain absorbable medical threads, such as catgut, polydioxanone, or polyglycolic acid, among others, into subcutaneous tissue or muscle at specific points. The insertion of absorbable surgical thread therapy is a unique treatment method. It combines absorbable surgical thread and acupuncture needles and boosts the virtue of producing long-lasting acupuncture effect. The insertion of absorbable surgical thread therapy maximally stimulates acupuncture points in the skin, tissue, muscle, and joints. This leads to a series of changes, such as softening, decomposition, liquefaction, and absorption, gradually stimulating the patient energy, patient Qi, and increasing their metabolic rate. I use this kind of needle with thread inside of them. Before I used, you know, that needles for anesthetic, trocar, and I put a little surgical thread in the top, and I use the other needle to insert in the muscle. That means to work very attentive with thread sterilized in a good environment. Don't give some problem because of technique. since they invented in China this kind of needles, the work is very easy, very facile. This is absorbed, and you see from the literature of specialty, we can use this method in few points almost for every disease. Because you will see the technique, we inserted this only one time at 20 days, because this time the thread needs to be absorbed by the tissue. And all these 20 days is working in these points. And I choose only 4 to 6 points in the end of a session of acupuncture. In my clinic, I used to give 10 days acupuncture. Then in the last session, I put these needles. After 20 days, in these cases of paralysis, not only by spinal cord traumatism, but even in children paralysis, in other chronic and great diseases, I used to come again to treatment after 20 days. Again, 10 days of acupuncture, and in last session, I did this insertion of surgical thread. This is my method. Maybe 1 year we follow this schedule, and to attend the very good results you will see. I hope you understand me. My English is not so good, but yes, I try to. We can use in a lot of diseases, not so often as in paralysis. Yes, but even one time in the last session of acupuncture, we give this to maintain the effect, to prolong our effect of treatment. Yes, studies have shown that acupuncture can prevent and alleviate muscle atrophy, thus improving muscle function. Absorbable medical thread performs the function of traditional acupuncture for an extended period of time, thanks to the thread mechanical and chemical stimulation. It has been widely used for the treatment of musculoskeletal diseases, but it's used in epilepsy, in asthma, in a lot of other pathologies. Let's begin with my case. It's about a boy. He was born in 2009, January 22, and presented to our clinic on 2023, May 15, with the following diagnosis. It's about quadriplegia, flaccid, complete urinary and fecal incontinence, established on 2022, June 19, following a diving accident in shallow water, 70 centimeters. It's jumping in this water, which caused a fracture of the cervical spine at the level of C4, C5 vertebral bodies, with contusion and hemorrhage of the spinal cord at this level and extending superiorly to C2, C3 and inferiorly to C7. Almost all cervical spine was flooded by blood after this accident. Before presentation at TCM clinic, in our clinic, he's following the conventional treatment in Romania, then in Belgium. Yes, you have these proofs, this document from UZ Gent from Belgium and from hospital in Romania. In Romania, they did fracture consolidation surgery and autologous bone antibiotic therapy, anti-inflammatory, and anticoagulant medication, followed by treatment with cerebral lysine and Alaner, and beside physiotherapy with passive mobilization. 1 month after surgery, the patient intensified physiotherapy and respiratory gymnastics. Between November 22 and December 22, the patient was hospitalized in the pediatric neurology department of the UZ Ghent hospital in Belgium, during which time he underwent a multidisciplinary rehabilitation program. Following the multidisciplinary rehabilitation program, the patient was able to maintain a sitting position with no loss of limb movement or sensory function. This was improvement after conventional medicine treatment. Patient presents when I see him first time: pelagic motor deficit, sensitivity disorders, sphincter disorders. He is conscious and cooperative. Very smart boy. And before of this, maybe I have to mention, he was a professional basketball player. From the 6 years old, he was integrated in national teams, Romanian national teams of basketball player. That means the body was very well developed at 15 age. Conventional medicine diagnosis: flaccid quadriplegia, sensitivity disorders, sphincter disorders. Interpretation of pathology and diagnosis from the perspective of TCM. Trauma like that of this patient generates obstructive P syndrome, which later also led to Way syndrome named flaccidity. I take care very much of correct diagnosis. If we can establish, and I teach my students in the same way, first diagnostic with all to this patient with trauma, but maybe with other comorbidities and with social and familial environment. All of this help us to do as a puzzle a good diagnosis. After a good diagnosis, we have to choose correct principle of treatment, because all method in TCM has to serve principle of treatment. If we have attained this goal, we have success. If not, maybe we have give another disease worse than first disease to the patient. And for this, I take your time to analyze very accurate the status of this boy. We have cervical spine trauma with vertebral fracture, with spinal cord contusion and hemorrhage that produced the obstruction and manifested as pelagic motor deficit. This is the situation when I saw first time this boy. And I need some example from ancient literature. I'm very amazed of to read and to understand old books in TCM. In my country, I'm working to translation and comment as a clinical practitioner of 21st century of Neijing Sowen. And every time I return to the knowledge there, is the most frustrating book in the world, because all I think I discover, I'm very smart, I find in this book, and very good explanation. Even Einstein theories of relativities, I find in this book. And I need, every time I need to prove with some sentences from this old book, not only Neijing, maybe other, but here I found and I choose these sentences. Kiko Matsumoto also discusses this concept in the combination Zhongfeng, liver. F is liver in Romanian. Sorry, I forgot to change the name. Liver 4, and Chiza is lung 5, to treat oketsu, the non-physiological accumulation of blood, which interferes with the circulation of all meridians. I have to tell you, before of this accident, this kid, this boy, was perfectly healthy, very strong, very good, sports people, and that is non-physiological accumulation of blood. When a major channel is deficient, this deficiency causes B channel syndrome, which will even develop into a vascular flaccidity syndrome. In chapter 45, on flaccidity in Suen, the first part in Neijing Suen. In most B-type diseases, contraction and tightness will occur when cold predominates, and relaxation and softening will occur when heat predominates. Why is this important? Because we treat in different way a paralysis with spasticity than another with flaccidity. Maybe in conventional medicine, there are same drugs, but we have to give different treatment. And this, we speak about flaccidity, you'll see. The origin of the problem was unpredictable. It appeared spontaneously. As the heat spread and intensifies, it begins to affect all 4 limbs. This is the spleen channel, atrophy way of the limbs. Once all 4 limbs are affected, all the meridians are affected and can no longer function properly and in a coordinated manner, because the external branches of the meridians are destroyed. You see, we have about patterns. We will have patterns of circulation, and especially not principal meridians circulation, but tendinous muscle meridians. The entire pathology is due to the disruption of circulation through the tendinous muscle meridians. So the treatment was chosen to both restore this circulation and balance the organs and support it. Look, a short presentation of this case. Tendinomuscular are the way Qi conduits, that means way Qi activates upright posture and activate movement. Tendinomuscular meridians move upward to support upright posture and support the occiput, the base of the brain. Don't forget, he has the problem in cervical region. The vertebral fracture and vertebral contusion and hemorrhage occurred exactly in the region below the occiput. The tendinomuscular meridians yang of the leg allows you to stand up, while the tendinomuscular yang of the arm allows you to then extend your arms. Then tendinomuscular meridian yang represents standing up, then reaching out, and tendinomuscular yin represent bringing things. Forward or outward movement is Tai-Yang engagement. Inward movement is Yang-Ning engagement. That means you have to know all this circulation. Where is the beginning and where is the connection in the circle? The trajectories begin with tendinomuscular leg Tai-Yang bladder. Look, here is about tendinomuscular meridians. When we stand up to move, we activate the lateral edge of the foot. This raises the medial arch, then the Achilles tendons and gastrocnemius are activated, and the knee is straightened. The gluteal region is engaged, and now the spine and the muscles that support it are stimulated, supporting the spine and head. You know, from the leg, from the gastrocnemius region, depend the power of cervical spine. And we can connect in this way all the body. We also need to anchor our shoulders downward to be able to move vertically, and thus the tendinomuscular meridians bladder also surround the shoulder girdle, look like back. This is the process that is activated daily to achieve an upright posture. Once we have stabilized the Tai Yang, the activation of the upright position, we can move, but the movement is not only forward movement, which would be rather spastic, but also movement from one side to the other, allowing us to change direction. It is tendinomuscular of gallbladder, which is the fluctuation, the rotation of the knee, and then the hip is what allows us to move laterally. It is the articulated area, so tendinomuscular gallbladder, which anchored to the central axis of the sacrum. The rotation capacity ends with the tendinomuscular median gallbladder wrapped over the head to connect to the opposite side, which allows for a balance between the two rotating sides like a seesaw. When we turn, one part of the body expands while the other contracts. This is reflected to some extent along the entire length of the body. Yang Lin Quan, gallbladder 34, is the area is under the knee in the lateral side of the leg, moves to rotate the knee, and after the knee, the rest of the body. Yang Lin Quan allows the knee to move freely, which then frees the hips and in turn, the diaphragm. We also need to be able to stop the movement. It is the tendinomuscular stomach. It is the activation of the pelvis, the quadriceps, and the tibialis anterior, which stops the movement. We need to begin and to stop and to rotate. Let's see the tendinomuscle meridians, young tendinomuscle meridians from the upper side of the body. Small intestine supports moving the arms away from the torso and establish contact. Tendinomuscular Sanjiao, the triple burner, allows the wrist and hand to rotate so we can grasp them. And finally, tendinomuscular large intestine initiates the extension of the index finger, thus completing tendinomuscular Yang's task of moving towards the word or an object. Diagnostic in traditional Chinese medicine for this patient was blood stasis and qi deficiency. Other two patterns is blood and qi of the tendinomuscular meridians, and Wei syndrome, heat deficit, which causes muscle flaccidity. I told you treatment principle, what we have to do to attend. Our goal will be regulate the circulation of blood and qi, cool heat, strengthen the spleen and heart. Method is very complex treatment for this kind of diseases. Is not enough only acupuncture or only herbal or I don't know, only psychotherapy. We have to perform as TCM doctors, acupuncture, scalp acupuncture, the insertion of absorbable surgical thread, and hydroacupuncture. In this case, I choose the formula of points. First, they are for acupuncture. For scalp acupuncture, motor sensory area of the upper and the lower limbs, because he was paralyzed quadriplegia. The insertion of absorbable surgical thread was performed every one time in a month. The 10 days acupuncture, last day surgical insertion, another 20 days. That means one time in a month, I did this method. We choose dorsal shoe points of the kidney, shen shu, and the liver, gan shu, is bladder 23, bladder 18, alternating with the dorsal. Not every time I use the same points. I choose every time maybe other formula according with the status of the patient. But this was often chosen. Spleen, P-shoe, bladder 20, and shoe of the heart, Shin shoe, bladder 15. And for hydroacupuncture, and another method, that means injection in point of acupuncture with different substances, because it's very difficult to have the extractive solution from China for this kind of diseases. I choose to take some homeopathic solution that are made in Europe, and it's easy for a patient to order and to have. And this injection I use in shen shu, the shoe of kidney, gan shu, the shoe of the liver. Dat zui is to my 14, yes, in just near to the area is point of every hit. All the hits in the body could be treated with this point. The surname, the nickname of this point is the point of all the hit in the body. And Feng Qi, gallbladder 20, with homeopathic solutions, cerebrum NM, and shoe points for on all that points is cerebrum, but in the lung shoe points, fei shu, bladder 13, and kidney, shen shu, with homeopathic solution placenta Swiss. That means we have two action with point injection. One is action of acupuncture, because we put a needle, is syringe needle in a point of acupuncture. Then we stimulate with a small amount, because, you know, we have 4 points or 6 points for a ampoule of 2 milliliters. That means we share drops of this solution in the points of acupuncture to increase the information, the vibration in these points. That means we stimulate their function with this small information with an homeopathic solution, or when with an plant extract solution, if you have possibility to import from China. The combination of several methods of stimulating acupuncture points, needle, surgical thread, injectable substances, was carried out in session of 10 session daily, one session of 10 session by month for 1 year. I told you, first year is this frequency. It's very hard to be supported by families, by patients, because they have to come. In Romania, TCM is only in private clinic. is very less supported by insurance. Maybe in the future will be better. Is not performed in hospital, in governmental hospital. That means they have to come and pay the treatment every month during a year, maybe more. Is another problem in our country. Absorbable surgical thread. Look, I show you two different. Both these boys has a spinal traumatism with, first is my subject, my patient who I described here. The second one has only in the thoracic spine traumatism with half a body paralyzed. Is different. And see, I use different points for catgut embedding. Yes. Insertion of acupuncture point is a special type of acupuncture, primarily involving the insertion of threads, catgut or polydioxanone, into the subcutaneous tissue or muscle at specific acupuncture point to prolong therapeutic stimulation. This involves inserting the thread into acupuncture point using a guide needle, then withdrawing the needle, leaving the thread under the skin or in the muscle layer. The thread used is soft and absorbable. While remaining in the tissue, the surgical thread softens, decomposes, dissolves, and is absorbed by the body. The selection of points for inserting the thread into the acupuncture points is based on the TCM diagnosis and the treatment principle. That means we have not fixed point. This is the point. Maybe another side of the body, according with the disease and with the diagnostic. Results. The patient began to make small improvements in both motor and sensory development from the first session. I remember my colleague was very happy when he put a finger in the foot, and he is not a good sensation. He has the first sensation of the touching in the foot, because before, no sensation. And improvement, both motor and sensory development for the first session, which increased over time. After the first year of treatment, the patient can maintain both a sitting and orthostatic position, voluntarily move his limbs, walk, small movement. Don't think he can perform ballet, but he can, I have small movies for this, walk with the edge of an exoskeleton and use his hands. He can even grasp small objects with his fingers. The patient can control his sphincters and has the sensation of defecation and urination. He can feel touch, it tickles. Treatment can be continued with longer breaks of the 1 month between session of 10 daily acupuncture session. Look, I hope I can, yes. Look, his father is assisting. Yes, it's ready. The other one. How to move this? Nobody help me. Like this. Look, can grasp some seeds, bean seeds, as an exercise. He can open a bottle of water for drink and can drink by itself. And look at his limbs and legs and hands. He could move. Conclusion. Absorbable surgical suture insertion therapy and the point injection as a subtype of acupuncture has gained increasing clinical application due to its long-term effects, higher patient compliance, and cost effectiveness. Periodically combining, inserting the thread into the acupuncture point and the point injection with acupuncture treatment accelerate its effect. The results obtained in the present case, as well as in other patients with a similar pathology, indicate the effectiveness of combining, inserting the thread into the acupuncture points with classical acupuncture. Point prescription must be individualized for each patient. Sorry, I'm tired. Thank you for your patience and attention.